we're going to talk about spectrograms. So spectrograms are basically a group as a whole assessment from 0 to 10 or 1 to 10, and they allow participants to see where they fit in within the group based on specific topics or criterias or goals or experiences. So when we're in person doing spectrograms, we basically would designate one wall within the room to represent a 10 out of 10 on the spectrum, and the opposite wall in the room to represent a 0 or a 1 out of 10. And we would ask participants to imagine every space in between 10 and 1 on that spectrum within the space of the room. So an imaginary line or sliding scale. And then we would ask a prompt, and we would ask everyone in the group to go ahead and get up and place themselves on this sliding scale based on where they believe they fit in within the group and within the prompt. When we're online, a simple way of doing it is to use the height of the camera feed to represent the scale from 1 to 10 or from 0 to 10, however you're going to do it. So if I said the prompt is 1 to 10, how much experience do you have in therapy groups? It's a simple, easy prompt that's not going to be too vulnerable or overwhelming for anybody to answer. If we're online, someone who doesn't have much experience in therapy groups might put their hand lower on the spectrum, whereas someone that has a lot of experience in therapy groups might put their hand closer to the top of the spectrum. And similarly, in person, somebody with lots of experience might place themselves closer to the wall that we designated as a 10 out of 10, whereas someone who's in a therapy group for the first time might put themselves closer to the other wall that was designated as a 1 out of 10. So this allows everybody in the group, as well as the facilitator, to quickly see where everybody fits in within the prompt for the topic. It gives us a quick visual of the entire group at once. This is an exercise that is really useful for assessing the group and giving the facilitator lots of useful information about the group's warm-up and about where the group is at any given moment. So in a client group, I might start by asking something easy. How much experience do you have in therapy groups? And with each question, we could have some sharing either at the group level. Whoever wants to share aloud could share why they put themselves where they're at on the spectrum. Or we could ask everyone to share in smaller groups with somebody close to them to promote some more one-to-one connection within the group. After an easy question, then I would move to a more difficult question. Maybe I would ask, how anxious were you when you thought about coming to the therapy session today? 0 to 10. And then we get group members sharing about some of their anxiety and more difficult feelings. I could then ask an even more difficult question. 0 to 10, how much has trauma impacted your life? And we could promote some more sharing about trauma and individual goals within a trauma therapy group. And then I would end with something more hopeful and future-oriented. Maybe I would ask a question about resilience. How resilient do you judge yourself to be on a scale of 1 to 10? With strength-based and integrative questions, I often find it helpful and even necessary to change the spectrum a little bit and make it a 5 to 10. So on that last example of resilience, I might ask, on a scale of 5 to 10, how resilient do you judge yourself to be? And I would even tell the group why I'm doing that. I might say that it's pretty common for us to sell ourselves short or to judge that we're less resilient than we actually are. And if you've survived what you've been through and you've made it to a trauma therapy group, you're at least a 5 out of 10 in resiliency. And I'm just not going to allow you to sell yourself short on that. So this is from 5 to 10. So again, we're following that 3-phase clinical map in the way we're structuring these spectrogram prompts. If you wanted to learn more about spectrograms, I would encourage you to check out the longer video I created demonstrating them in action and discussing them further.